Hi, this is Ann Niedermeyer. In this presentation on tuberculosis, I hope to offer some introductory information about the disease with hopes that those watching will come away with an improved understanding of tuberculosis. TB is typically thought of as an active respiratory infection and not readily seen here in the United States, but in actuality, there are more complexities to it than we realize. So let's take a look. We're going to cover epidemiology, pathogenesis, clinical manifestations, diagnosis, implications for the nurse-midwife practice, prevention, and treatment options. In our country, in the United States, we don't think of tuberculosis as a pandemic, but in actuality it is. If we look at the prevalence of TB, we see that 9 million cases annually are contracted. TB has been the world's largest killer from a single infectious disease until COVID-19 superseded that spot in 2021. The morbidity equates to 10.6 million infected worldwide. This is those with an active infection and does not include those with a latent infection. The total of both is almost 1/3 of the world's population. Worldwide, TB claims 1.6 million lives annually. That is 1 death every 20 seconds. A household with tuberculosis illness can spend as much as half of their annual income, depending on the level of their income. The CDC invests about 80 million annually for prevention and control, along with 20 million in research. Tuberculosis rates rose in the early 1900s, especially during the World Wars, and we saw a rise well into the 1950s, which is when antibiotics were introduced. After that, there was a sharp decline until the 1980s, when we saw rates rise again. This is correlated with the introduction of HIV. Taking a look at this map, those countries with the darkest blue hold the highest infection rates. Southeast Asia leads at 43%, and Africa is second at 25%. As you can see, for the US, our rates are very low, along with Europe and Australia. If we look at this map indicating HIV prevalence with those infected with tuberculosis, we see a similar pattern of infection rates, showing that the vulnerability of the immunocompromised TB takes advantage of the person's lack of immunity, infecting more easily and readily. The Mycobacterium tuberculosis is the bacterium responsible for the TB infection. The mode of transmission is airborne, meaning that the bacteria is dispersed through the air when an infected person talks, coughs, sneezes, or sings, and a receptive host inhales that air. The bacteria travel down the bronchi, settling into and colonizing deep in the alveoli. The lungs are a perfect environment, as this aerobe bacteria needs oxygen to survive. It is a very resilient bacteria, as its cell walls have increased lipids and a wax-like component, preventing attacks and breakdown. Macrophages will attempt to kill the bacteria, but they fail due to the unique cell wall construction of tuberculosis. The bacteria are ingested by the macrophages, and these can remain in the lungs or travel throughout the body from the lungs and spread the bacteria to multiple body systems, including the brain, kidneys, spine, central nervous system, liver, etc. The initial infection is considered a primary infection. In the lungs with a primary active infection, granulomas will develop, forming what is called a gone complex. Calcifications and scarring will form around these. After the gone phase becomes latent, signs and symptoms of TB will resolve and the infection enters latency. Latency may last for months or even years, until it is reawakened, usually due to stressors in the immune system such as HIV or age. Then it is called secondary TB infection. Most healthy people develop what is called latent TB. That's what we see on the left. It is contained in the immune system. They don't even know they have it. They feel well. It's not active in the body, and it's not contagious. Active TB, which is on the right, usually develops within pediatrics, as their immune system is a little more immature, or the immunocompromised, the elderly, and those with comorbidities. These are typically the same people whose latent infections become active. With active TB, people feel ill, experience symptoms, and are contagious, and it can progress towards death if untreated. Symptoms include incessant cough, followed by fever, chills, chest pain, weight loss, fatigue, night sweats, and after time, the cough produces a blood-tinged sputum and the person experiences dyspnea and orthopnea. If the infection spreads outside of the lungs, it is referred to as extrapulmonary tuberculosis. Most of the symptoms are similar to pulmonary tuberculosis, along with complications of the particular system that is being attacked. So, such as a meningitis will form in a central nervous system infection, spinal deformations with a spinal infection, pericarditis and ECG changes in a cardiac infection, and in a GI infection, it may mimic Crohn's disease. When granulomas spread through the blood, affecting soft tissues, it is called miliary TB. To diagnose tuberculosis, it takes a few steps. There is screening, and ultimately, positively identifying the bacterium needs to happen. The most common screening is the tuberculin skin test known as the MANTO. This will indicate whether the individual has been exposed to TB and can detect either an active or a latent infection. A positive result will need to follow up with a chest X-ray. On X-ray, any calcifications or scarring from the Gone complex will be seen. This finding is significant for either untreated active TB or latent TB. The Gone complexes are typically seen in the upper lung where the optimal ventilation and oxygenation occur. Other tests include acid-fast staining, sputum cultures, gastric aspirations, and a quantiferin TB Gold is a blood test which can result in 24 to 48 hours. A DNA-RNA nuclear amplification offers a definitive diagnosis. A false positive will result in those who have received the BCG vaccine, which is the only tuberculosis vaccine available, as they have created an immune response in their body. False negatives may result in those who are immunocompromised and unable to produce the appropriate immune response. As nurse midwives, we are primary care providers, and that means we must address a variety of health concerns for our clients. We need to be able to explain and recognize signs and symptoms of the disease, order screening tests for those who need, and offer education and referrals for those who are infected. We will need to be able to understand and educate about tuberculosis in relation to fertility, pregnancy testing, and maintenance during pregnancy. Not treating tuberculosis during pregnancy represents greater dangers to the mother and fetus than the treatment process itself. If remained untreated, babies can be of low birth weight and on rare occasions can actually contract tuberculosis. The vaccine for tuberculosis is the Bacilli Calmette-Guerin vaccine, or BCG, which is approved worldwide. It was developed in 1921, and it is most commonly used in countries with tuberculosis prevalence and spread. We don't see it used a lot in the United States, typically as the criteria is not commonly met. Hand hygiene always helps prevent disease and infection, and in using an N95 mask and avoiding exposure to those infected helps to prevent the disease. If someone is infected, they should remain in a negative pressure room. Healthy diet and lifestyle are also helpful. Untreated cases can result in death in over 50% of the time, so please keep in mind that treatment is available and should be sought out. The type of tuberculosis infection will determine the treatment course: pulmonary or extrapulmonary, active or latent. Tuberculosis is a complex organism exhibiting a high mutation rate and a high drug resistance. The goal is to assure that all of the bacteria have been eradicated. Treatment requires a multi-drug approach for a lengthy time, usually 3 to 9 months. Those with an active infection or known exposure from an actively infected person will be treated with an antimycobacterial. Those with latent tuberculosis or history of inadequately treated tuberculosis will undergo prophylactic treatment. This table shows the first-line medications typically used for tuberculosis. It's not an exhaustive list, but these are usually the go-to medications for treatment. Those being treated need to remain vigilant, following their treatment instructions, as it is imperative to preventing the drug resistance. Thank you for listening to my tuberculosis presentation. I hope you learned something and something to take away or pass on to someone else. Here are my references, and have a great day.